Of course, we go back to what was reported yesterday on the situation of the coronavirus in the Gambia, because the number of people who contracted the contact of COVID-19 pandemic in the Gambia has increased with the confirmation of a fourth case patient on Sunday. Health Minister Dr. Lamin Samate said the new case is a Gambian in his 50s who arrived in the country on the same flight with the fourth case on March 15, with one probable case whose results is pending. For more details on that, we go with this report.
Gambia's COVID-19 pandemic situation has changed with the confirmation of the country's registration of a fourth case patient on Sunday. Health Minister Dr. Ahmad Samate announced the confirmation of the fourth case following a laboratory test on 23 people. He said there is still one probable case whose test results is inconclusive. He said the new case is a Gambian in his 50s who entered the country from France on the same flight with the first case patient.
The recently confirmed case, that is the fourth confirmed case in the Gambia, is a Gambian gentleman in his 50s who arrived in the country from France by Royal Air Maroc, flight number 8579, on the 15th of March 2020. He was in the same flight as the first case, even though they originally departed from different countries. His issue was reported to the Rapid Response Team through the National COVID-19 Hotline 1025, being operated by the Ministry of Health. A sample was collected from him and the positive test result came out on the night of the 28th March 2020.
Health Minister Samate said 16 of the close contacts of the fourth case has been placed under quarantine, while plans are on the way to have their samples collected for COVID-19 testing. The first case in the country is a female Gambian who entered the country from the United Kingdom, and the second case is a Bangladesh man who entered the country from Senegal. He was confirmed to have contracted the virus after his death, while the third case is a male Gambian from France. Mr. Samate said conclusively Gambia now has 4 confirmed cases of the global health-threatening disease that has been declared as pandemic by the World Health Organization, with one probable case.
For the probable case, we have a new probable case that has been reported as the laboratory results of one of the contacts recently came out inconclusive. So that is the probable case we are talking about. A repeat sample from the probable case will be taken and tested in a couple of days to conclusively determine whether it would be COVID-19 or not.
On Friday, President Adama Barrow declared a state of emergency in the country and ordered all government and private institutions to scale down their work. He also ordered for drivers to reduce the number of passengers to half, and all places of workshop be closed with no gathering for more than 10 people.
To curtail our exposure to infection through close interactions, my government has taken the decisions to scale down government operations. Accordingly, all heads of government institutions, parastatals, private enterprises, and other institutions have been instructed to scale down their activities with minimal staff to perform basic services. Where feasible, staff can work from home.
The government has earlier banned all public gatherings, closed the borders and airspace, and announced $500 million is COVID-19 emergency response. But its actions were criticized by many citizens, saying the government was late in taking decisions to protect the people. Reporting for iAfrica News, I am Absege.